Hi, my name is Laura Cox and I am Shield Healthcare's Ostomy Lifestyle Specialist. Today we're going to be talking about intestinal blockages. One of the questions I get most is, what is an intestinal blockage? An intestinal blockage, also known as a bowel obstruction, is basically when either the intestine is twisted, it's swollen, or there's food lodged in the intestine that does not allow output to empty outside of the body. The symptoms are abdominal pain, stoma swelling, bloating, nausea, and sometimes vomiting. Because think about it, it's food that is going through your intestines and is trying to get through but cannot. Another symptom of intestinal blockage may be a lack of intestinal output. So I say sometimes because there are partial intestinal obstructions and then there are also complete intestinal obstructions. So complete, there is absolutely no intestinal output, whereas a partial intestinal blockage, you may have a little bit of gas, a little bit of stool coming out, but not a lot. So what do you do if you have an intestinal blockage? So first and foremost, it's important to note that if it seems like a severe intestinal blockage, you should try to get a hold of your doctor. If you cannot, then go straight to the emergency room and they'll take care of you there. If it's not so severe, call your doctor, and while you're waiting for them to get back to you, there are a few steps that you can take. One of these steps is starting to move around. So walking really helps move the digestion process along. Going and taking a warm bath or putting a heating pad on your abdomen can sometimes allow the muscles to relax, and then the stoma can kind of do its work, or your intestines can do their work. Another thing that you can do is drink a lot of water. This is very, very important because it just helps that food that's impacted. It helps to open up the intestines, push the food through, or unravel those intestines, which really helps clear that blockage. Some beverages that can be especially helpful to clear blockages are grape juice, carbonated beverages, and hot tea. Another thing that might be helpful is trying different positions and moving from position to position. Try lying on your side. I like to put my forehead on my forearms and my butt up in the air. One thing that I find works exceptionally well for getting rid of an intestinal obstruction is gently massaging the area around the stoma, and this just helps to manually move the food through the intestinal tract. Abdominal massage might also work for people who do not have stomas, but what I find really helpful with my stoma is manually massaging towards my stoma to try and encourage the food to come out of the stoma. So for people who have intestinal obstructions that do have a stoma, check to see if the stoma is swollen. If it is, it's very important to take the wafer off and cut a larger hole in a new wafer and put that on. This way we're just not estrangulating the stoma. If you suspect that you have an intestinal blockage and your symptoms escalate to vomiting, this is the time to go to the emergency room. Another question I get is, what will happen when I get to the ER? So my experience has been that they admit you into the emergency room, they start an IV for fluids because being hydrated helps with eliminating blockages. They'll talk to you, ask you what you ate, what your symptoms are, and they'll probably order a CT scan or an X-ray. I had a CT scan so that they could see where my blockage actually was. One thing you can do to prevent intestinal blockages is to avoid hard to digest foods like uncooked vegetables, nuts, seeds, mushrooms, and corn. When you are eating things that are harder to digest, don't forget to chew well. Chewing well is the first step in digestion, and also it takes some of the burden off of the intestines. It's really easy to forget to chew very well, especially when conversation is really great, but it's a really important step to avoid intestinal blockages. And it's always helpful to stay hydrated and drink fluids after a meal. I was pleasantly surprised about recovery after an intestinal blockage. It was very fast, and sure, the intestinal blockage was painful, but once it passed, I felt pretty good. Always follow your doctor's instructions with diet, hydration, exercise, and follow-up appointments after experiencing a blockage. Everyone's experiences with intestinal blockages may differ. These were my experiences, and I hope this video was helpful.